Welcome back, everybody. The Hotspot continues on Facebook, YouTube, and KUM TV. Minority Leader Senator Chris Duenas joins us right here. Senator, it's so good to see you
Off a day,
in
Jason.
person, to see those amazing island print shirts that you always rock.
In person, so glad to be here.
Well, you know,
feeling great.
Yeah, welcome to the
Thank
show.
you.
Welcome to the set, and welcome back to hopefully a semi-normal way of living for us on the island.
Absolutely.
Well, I know in your role as the Minority Leader, I'm sure that, dare I say, a majority of what you've been thinking, not only just today, but in previous days and everything, has been trying to end, this whole public health emergency and everything like that. And you have crafted a resolution to do just that.
That's right, Jason. And, welcome. Glad to be here and glad to talk to the people of Guam here on the Hotspot. Jason, when we look at the anniversary now, the 2-year anniversary of the public health emergency, we look at all the different things that we've been through. One of the things that I tried to do early in this term with Bill 11 was to kind of bring together the legislature and the governor's office to speak together and try to speak to the people of Guam with one voice. By having the governor come to the legislature every month to get the 30-day extension on the emergency. The bill passed, but obviously the governor vetoed it, and for some reason did not want to engage in that manner in terms of extending the public health emergency. And so a lot of what this effort is about right now is, first and foremost, we believe it's time to end the public health emergency. I've heard the governor state in other media that she believes that we're transitioning to endemic and maybe in a couple of weeks. And also you see the lifting of certain restrictions. But Jason, I think more importantly, for the minority and particularly everybody on this resolution, the 6 of us, this is about the law. And this is about whether or not the governor at this point respects the law and respects the emergency powers in terms of the check and balances within the government. She demonstrated through the issue when she took the issue to court on the quarantines. And what she went for in that declaratory judgment was Chapter 19, the emergency health powers as drafted by the legislature, it does not apply to me. I am an Organic Act governor. I govern with absolute powers when it comes to emergency powers. Yet she continued to extend the public health emergency every 30 days, which is compliance with the law. And I tried to make sure that we would be a part of that. And also she continued, really, if you think about it, to test myself and others on the minority, saying, if you don't agree with the way I'm administering this, move forward and shut it down, because that is what's in the law. Now, if you don't believe the law is durable enough, then why challenge us on the law to shut it down? So one of the main reasons why we introduced this resolution was to say, we respect the law as passed by the legislatures over 20 years ago by that legislature, to say, these are the Emergency Act powers and pandemic powers that have been put forth for the people of Guam and for the governor to follow. And so basically we're testing that at this point.
Now, may I ask, Senator, and I like how you brought that up, is you have been fighting this fight, let's say,
Right.
for some time now during the pandemic. This is not your first time up to bat with this particular issue.
Right.
To use a baseball analogy. I know
Sure.
you're a big sports fan.
Sure.
Was it just the 6 of you who decided that this would be the best course of action to pursue, or were you getting like a lot of feedback and a lot of pleas from the constituency saying, can we please end this thing? And given the fact that Uncle Sam said, as long as you are still technically under the public health declaration, within reason, we'll continue to cut checks and help you out.
Sure. I want to recognize the Guam Freedom Coalition. Their membership has been extremely strong. They've had demonstrations, they've had hearings whereby they've assembled themselves to where they would call senators and anyone who would listen. Basically, they looked for an audience with the governor in terms of the way that they feel. And I can tell you, particularly Bistra Mendiola, she has come to us a number of different times, and she has put on in the legislative record. Thankfully, the speaker did enter their petition to the legislative record. They have really done a lot of research and science-based information where they've asked tough questions in terms of how this emergency has been being continuing, and in terms of whether the need for all the restrictions has been there. So it's been a lot. So
you're building your case.
Yeah, there's been a lot of public sentiment in terms of lifting restrictions well before the introduction of this resolution. And so yes, it's been a community outcry. We believe certain doctors as well. You know, I've talked to a number of different doctors off the record that believe that the current or the way that a lot of the mandates were being managed, there were other ways to do things. Now, Jason, I've heard that, you know, this is reckless. You're going to jeopardize federal funds. I've done a lot of research on this as well, Jason. If you go to the National Council of State Legislatures and you see all the states that have been grappling with this issue as well, there's been no less than 27 states where their state legislatures have challenged governors on emergency powers. There are some states, Jason, who never even went into a public health emergency, and they have no problem administering their federal funds. There is no way I've ever seen any evidence that says we cannot administer these federal funds, we cannot stand up the National Guard, we cannot have certain vaccinations. And even if, for say example, Jason, that existed, then why not cancel this current public emergency? And the governor, by executive order, just like right now, has the ability to move forward and just put those things into place that are needed. One thing that's been troubling the 6 of us in particular, and even the 8 members, you know, the 6 of us were joined by Senator Talina Nelson and Speaker Terlahi to support Bill 11 that was vetoed. If you really look, at that, the whole intent with regard to that, we respect the governor's executive authority and executive orders, but there's no reason to continue with this blanket procurement, this emergency procurement that's going on for tens of millions of dollars. Hiring in the government that basically is not being done through the merit system because it's being brought on by emergency. It is the legislature that is going to end up having to support all this government hiring if those individuals end up being classified employees. This is why the legislature has to have a voice in this process.
Very well. And I know, we've had you on the link, several dozens of times where, you've talked about the progression of this argument that you've made. And now you believe that there's a bunch of evidence, as you said, from the science standpoint, from the public policy standpoint. A final question before we let you go.
Sure.
How confident are you now that you've presented this information and you've gotten it on the record by way of the resolution that when brought to Adelup, the governor might say, at the end of the month, it's like, okay, it's done now. How, if you were to wager on that, let's just say, how confident are you that this will be the end of the public health emergency?
Well, Jason, what surprised me so far, I may be surprised later today, but I was fully expecting a full-throated rejection from the governor. I haven't heard that yet with particularly to this resolution introduction. In fact, what I'm hearing more than anything else from other media sources and people that are calling me, they're saying, Chris, it looks like this is going to end anyways, because the governor's speaking in terms now of the transition to endemic. We don't know what she's going to say during her speech, and I wish her the best. I wish the governor of Guam the best. This is not personal for me. This is all about checks and balances in government. I'm confident that if this resolution gets a public hearing next week and hits the floor for this session, it would pass.
Well, like I said, in the art of deal making, I would rather have a slow yes than a quick no.
Absolutely. And I think what's important, once again, Jason, because even if, say, for example, the governor ends the public health emergency, I'm going to spend the rest of this term trying to get Bill 11 overridden, because that is the real key to checks and balances. There is no reason why for every emergency, the governor couldn't have come down and worked with us and compelled us to say, this is the issue that we have going forward. Please see it my way. And if we did, I'm sure we would have passed a resolution to say continue emergency.
All right,
the problem is that there was no effort to work together. And so for me, I think we need to change the law and test the law and see if the governor would also take that for declaratory judgment and say that law doesn't apply to me.
All right, well, Senator, best of luck on this. I know you've been working on this a very long time, and we'll certainly follow up with you as this progresses. Thank you very much.
Thank you, Jason, and a lot of fun being on the hotspot. Love you, Guam. Take care and be safe.
First appearance of many, Minority Leader Senator Chris Duenas. Please stay tuned. We are back with more Hotspot right after this.